Our next portion of the evening is a panel discussion with respondents, and I'm going to introduce the respondents, and interestingly, the respondents lined up almost exactly the way the PowerPoint reads, so we couldn't have figured that out any better.
We did.
But thank you, Dr. Rondelli, for your wonderful presentation. And I want to introduce the respondents. And the format will be each respondent will talk for about 5 or 10 minutes in serial fashion, so starting with Dr. Keene and then moving all the way to Dr. Rondelli. And then we'll have a colloquy, a discussion, and we have a couple of our Newman students, our volunteers here, so we have Jason and Tim with microphones, and they can circulate so we can have a nice discussion. Let me introduce Mary Keene, MD. She's the Medical Director of Pediatric Programs, Marion Joy Rehabilitation Hospital, Clinical Associate Professor, Pediatrics and Orthopedics, and then Loyola University Stritch School of Medicine, and then President of the Catholic Physicians Guild of Chicago. I might add that, like Dr. Rondelli, on either side we're bookended by two of the top doctors in Chicago, according to Chicago Magazine. So, Dr. And of course, just like in New York, U.S. News, universities say it doesn't really matter, but in some ways it really does. And so, Dr. Keene is noted for rehabilitative pediatrics. She has 4 board certifications in related areas, and of course Dr. Rondelli described his work, so you're familiar with it. Next are Don and Caitlin Lassus, family physicians, Erie Family Health, Albany Park. They spent some time in El Salvador together, have a very interesting joint career as family physicians, and what we did is Dr. Caitlin spoke to the medical students earlier this year, and we've asked both of them back for a reprise. So they'll be describing their work in sharing family, children, family practice, residencies, you name it. So we're very privileged to have them this evening. Dr. Lisa Anderson-Shaw is Director of Clinical Ethics Consult Service at the U of I Hospital and Health System and Assistant Clinical Professor, UI College of Nursing. And I've gotten to know Lisa much better this year, serving on the U of I UI Hospital Ethics Committee, where she really drives the process and is the glue that holds that committee together. So welcome, Lisa. Dr. Shaw, and also Nancy Valentine, who's Associate Dean for Practice, Policy, and Partnerships, Clinical Professor, Health Science, Systems Science at the UIC College of Nursing, and we're very privileged for Nancy to be here this evening. I've also gotten to know Nancy. I think we first met when Dr. Barish was giving his round of job talks, and we met at that moment. But if you go to the biography page on the web, we didn't print it, but you'll find that our panelists are a very distinguished group. I just found out that Nancy was the head nurse for the Veterans Administration for a number of years for the entire U.S. So a very distinguished panel, and I'd like the panel to get going. So, Dr. Keene, would you like to begin your remarks?
Thank you, Dr. Schorsch, and thank you, Dr. Rondelli, for your interesting reflections. Help me contemplate a little bit more about what drives me, and what am I here for? Why do I go to work every day? I also was intrigued and interested in that analogy of the church as a field hospital, and I was really happy when Dr. Schorsch mentioned that you were going to be talking about it, not knowing that I was going to be asked to talk either. So I have a few thoughts to share. In any given field hospital, whether it's a battlefield or whether it's a set up to take care of a natural disaster of some sort. There are certain injuries that are going to be more common than others. In the battlefield, there'll be shrapnel and bullet wounds. In a natural disaster like an earthquake or something like that, there'll be blunt trauma. Here in the United States, I think we face certain spiritual wounds that affect all of our practices to a greater or lesser degree. And this concept of field hospital led me to think a little bit more about those sorts of wounds. We need to think about how to treat those wounds as well, because they're pervasive. They hold people back from living full, complete, happy lives. So we need to have some idea about how to treat them. There are quite a few of them, but I'm just going to talk about 3 that I have some personal experience with, which I think are not discussed enough. Number 1 is abortion. 1 out of 3 women in the United States have had at least 1 abortion. Many have had more than 1 abortion. Of these abortions, 60 to 70% are coerced. 60 to 70% of the women who undergo these abortions feel forced, feel they don't have a choice, are going against their heart. And as a consequence of that, can suffer severely for years. Abortion is a traumatic experience. Women who are forced to go against their instincts, what they're taught, what they believe, often will feel self-hatred and regret and anger towards themselves, towards the people who pushed them to it. Many women that we work with have that in their past, but they're not likely to share it with us. They're likely to hold it close, but they're going to come to us in pain, not saying, "Doctor, I had an abortion and that's what's hurting me," but coming to us with severe depression, intractable depression, doesn't respond to medications. They'll come to us with substance abuse, alcoholism. They'll come to us as victims of abuse. They'll come to us as crime victims because they feel they don't deserve to live because of what they did. Another area where I have had even more personal experience is with parents and families of individuals with disabilities. Most of my practice encompasses children who have cerebral palsy. I also work with spina bifida, brain injury, muscular dystrophy, things that end up with lifelong difficulties for the child as well as for the family. And the most common concern of these families, even if they're dealing with medically complicated kids like with trachs and G-tubes and portacaths and the whole spectrum of technology, their biggest worry is how lonely their child is and how alone and isolated they are. Even their own relatives don't seem to appreciate how hard they're working every day just to get out of bed, just to get the kid to school. These families are very lonely, and the mom's worry is, what's going to happen? Is anybody going to be a friend to my child? What happens when I'm not here? So I encourage all of us to think not just about our patients, but the people who care for them. The last thing I want to talk about is depression among doctors, burnout amongst physicians. The last statistic I read was about 1/3 of practicing physicians and up to 2/3 of resident physicians are depressed at one time. I'm not surprised. What we do is physically and emotionally exhausting. Those of us who are Catholic are really fortunate. We have confession. We have the Mass. And we have the collegiality of physicians who are like-minded to help us make it through some particularly tough times. The last thing I wanted to mention was I think we need to remember that in the spiritual field hospital, we are all patients. We are the walking wounded entrusted to care for others, but nonetheless, we are all individually wounded ourselves. We all need the care of the one real doctor. That's all I have to say.
Very nice.
Thank you.
So my thoughts in preparing for our discussion tonight really revolve around, I would say, Dr. Keene, one of Dr. Keene's last points, and something that Dr. Rondelli mentioned when discussing how Mother Teresa's sisters prepared themselves to go into the field hospital every day. One of my reflections about the field hospital is that in my young career as a physician, I've already seen and feel that working in the field hospital spiritually and practically in medicine, Caitlin and I both work for a community health center where all of our patients are either Medicaid or uninsured, and so don't have the same resources, or they grow up in struggling and obviously harder conditions. So the field hospital for me is a place that's also dangerous for the doctors. In Syria, hospitals have been bombed. Suicide attackers will go into field hospitals. In war, the hospital itself is not safe. And so as a physician or as a person spiritually working in the field hospital, it can be kind of dangerous. You're putting yourself in precarity in terms of your even when you're practicing medicine in the field hospital, it's not pure like what you learned in med school when you're under-resourced. And then morally, it's also you're in that tension that Dr. Rondelli was talking a little bit about, in his experience of thinking and reflecting on stem cells. Most of my colleagues are not Catholic. They share a commitment to serving those who don't have insurance and immigrants, and obviously have a lot of great charism for serving the poor in other ways, but then they also, some of them perform abortions at Planned Parenthood. And so those are some of my colleagues, and those are some of the tensions that I feel in the job that I have. But if I really, to be able to serve the poor, this is also an amazing organization that I'm working for to do that every day. So those are those tensions that one can feel, and the kind of moral quandaries that you put yourself in when you go to the field hospital, when you go to where the poor are sometimes, and especially in our healthcare system in the U.S., the kinds of colleagues that are attracted sometimes to work in those areas. And that the issue of burnout has been something that's really, when you work in the field hospital day in and day out, and like I have a patient who herself, she was a former gang member, and during the uptick in violence in Albany Park recently, 2 of her friends were murdered. In the course of a year, she's had these 2 traumas, even though she herself has left that life, or tried to. And I see her maybe once every 4 months, and she has diabetes too, and I know I'm not going to treat her diabetes because she still is not at a point where she's going to deal with the deeper wounds of her emotional wounds of her upbringing. And then unless you go to battle every day with prayer beforehand, as it were, or have that deep spiritual life of understanding why you're doing what you're doing, it really can, you can get very worn down, and when your words are the best Band-Aids all the time, and your empathy is really all you have besides, those are the best bandages you can provide, that can, it's hard to articulate, but I think you guys get the idea that the field hospital is, it's a very interesting challenge, I think, spiritually for us as Catholics to really engage there when it's so much easier to be back in the White City with your, with the comfort of your orthodoxy or an easy prayer life, but to really engage really is very challenging. But I invite all of you young students to do it.
So I have the privilege of doing what I do every day with Don, and we were discussing this amazing quote of Pope Francis in the car on the way here. And hearing his reflections on this image helped me to crystallize something that I felt when I was reading these homilies of Pope Francis, admittedly Googling them before this event. And to me, this idea of the field hospital and going out to where the battle is going on was both affirming and also a call from the Pope, affirming in this everyday life that's messy, and that's often makes me feel like I want some place that's simpler, some place that I can have just be surrounded by like-minded people and not have ethical quandaries every day. But at the same time, I feel a real call to be where I'm practicing medicine, and have always, as a student and as a person, felt called to go to the margins of society, but I won't necessarily say the margins of society, more places in the world where I didn't grow up and that are different from my experience. So not necessarily places that need to be healed any more than my own home, my own family, my own life, but places where I can provide service, but also grow myself as a person and as a Catholic and as a believer, and as part of someone who believes that I'm connected to everyone else in the world. In being this person who feels called to go outside of my comfort zone, I have sort of also developed a similar philosophy to some of what Pope Francis is talking about. And part of the extended homily, one of the homilies where he talks about the church as a field hospital, he warns against too much organization around serving the poor and serving people who are wounded. And I feel like in my own life, some of my most important experiences have been outside of the walls of an institution, outside of the walls of a medical school or even a clinic. And And that I also found affirming, and also just made me think, yes, you know what, I'm going to keep seeking out those experiences, even if I have an MD after my name now, and I have a very distinguished career path that most people would expect me to follow. I will continue to accept a friend's invitation to go and try to coax a homeless woman out of her tent on the side of the highway, which happened a couple of weeks ago and turned out to be a several-hour affair, and Don, I think, was a little worried at some point. But that mention of me as a physician, as this identity that I usually carry with me every day, was actually something that the two of us didn't necessarily reveal, because it was more about building trust and meeting someone where they were, especially because of her mental health issues. And then she herself brought it out in a beautiful way, just, an hour in, said, I don't know if any of you have any medical experience, but, and then it was an invitation to say, well, yes, I am actually a physician, and, if you want me to look at your wounded feet, I can. I don't need to. I don't have here in the street, I don't have any boxes that I need to check off on the electronic health record, but I'm, happy to peel away the sock and to try to help in whatever way that I can. And so in the spirit of kind of calling on the people who are here, who are looking for a path, I think part of that field hospital is being a little critical of just staying within the confines of what we have as the medical establishment, and really being creative and really being open to calls and invitations to use not only your medical knowledge, but just your love and your presence, your empathy, as Don was saying. That was the quote that I wanted to take with me from his reflections as he was telling them to me in the car, which was that so many times our empathy is our best and only bandage in the field hospital that we have chosen to engage in. So those are my reflections.
Well, I did also Google a few things because I wasn't as familiar as I should have been, maybe. But I'm Lisa Anderson, and I'm the clinical ethics consultant for UI Health. And I am the co-chair of the ethics committee, of which Dr. Schorsch is a member, and maybe a few of you out there. And I'm very grateful for this opportunity and for Dr. Rondelli's talk. And what I came out of the whole thing is looking at comfort zones, because we all have comfort zones in different areas of our life. And I grew up in a small farm town somewhere in Illinois, not here. Small, we're talking 1,800 people. And my comfort zone was, this was many years ago, so we didn't have the internet. We had 4 stations on our TV. And yet we got by, and we had fun, and we did all the things we wanted to do. But my world was so small. And I was pretty comfortable with that. I went to church every week, went to youth group, went to choir, I did all those things, and I enjoyed all of the comforts that came with rules and things like that. So then I went to college, and I went to graduate school, and I've been at UIC since 1988, so I'm maybe one of the oldest people in the room, but I've been here a really long time. And prior to that, I was in graduate school at Indiana, and I worked in the ICUs. I was a nurse, and I worked off shifts always because I went to school during the day. And I remember this is like right when we started getting HIV patients in the Midwest, and it was very controversial. We didn't know, we didn't have universal precautions. We never wore gloves to start IVs. We just took care of our patients, and we started getting this. I worked in the pulmonary and cardiac units, and we started getting patients with this HTLV3 virus that nobody knew anything about. We didn't really know how, but we knew it was deadly, and our patients would die. And I worked with many different folks. It was a public university, but I love taking care of these patients because I would talk to them and we'd interact. But I also didn't judge whether or not how they got it, because there was always a story with every patient we got, how they received their HIV. Back then it was very much of a gay disease, and it was very judgmental when people would come in. And I took care of actually a priest who came in with HTLV-3 and pneumocystic pneumonia, and there were a couple of Catholic nurses that wouldn't take care of him. Now, I had no problem taking care of him because my sin is no worse than any other person's sin, and I knew how to take care of him. And I was very pleased to be there when he died because he trusted me, and I felt like, we don't know what people come into our field hospital every day. We don't know their background. We don't need to know most of that. All we need to know is that they need help and that we can care for them. And when I came to UIC, I fell in love with our patient population. We take care of, most of our patients are uninsured, Medicare, Medicaid, a little private pay here and there. And we give a lot of charity care. And our ED is a war zone, not nearly as bad as Cook County, perhaps, or Stroger, but it is a place where people come in and they have a lot of problems that they come in with, not just the medical issues. And what I loved about Pope Francis's talk is that, we have to take care of a lot of those social needs, spiritual needs, before we can go to the healing part. Our patients come in with a lot of comorbidities. We have what we call difficult patients. I'm the ethics consultant, so I'm the last-ditch effort. When nobody knows what to do with anybody, they call me. And we have a fair amount of frequent admissions, frequent ED visitors. And they come in and they get discharged. Then they come back and they stay in the ED for a few hours, and maybe they're admitted. But there's magic words to say, like, my heart, I'm having chest pain. That will probably get you admitted overnight, and then we'll do tests and things like that. But when we get down to it, there's so many social and financial issues that they can't even begin to heal because they don't have a place to live. Their home is disrupted. They don't have enough money to take care of their children. They need respite. So they come in our ER. They go in your ER. They come anywhere just to get that rest and some attention. And so I loved that this piece of healing people is just so multifaceted. And in medicine, we can't do all that, but we're trying. It's just very difficult. And I also I did some work and some online work, and Pope Francis did talk about how we should be like the Good Samaritan that washes and cleans and raises up his neighbors. So we need to seek those people out and help them, no matter what their background is. And I've learned so much from the people I work with because we're all different at UIC, and in most places these days you have lots of different faith-based folks, and we learn from each other. But our mission is always the same: is to help and to restore health. So the inner city is much like a battlefield. There may not be so many war wounds, but there are so many deep-set wounds that you've spoken about the trauma that they have just from everyday life that I will never experience, and I can't even sometimes relate to it. So the questions that I come up with from a health policy standpoint, too, is what can we do to meet some of these basic needs, to provide restorative health care? These are big questions that we can't answer, but we need to try harder and to make it a little more political, that there are so many ills that we can't fix, and how do we even begin to do some of that? And we see disparities every day in health practice, and what is the just allocation of our resources when it comes to healthcare? Because we know at discharge, when someone has supplement A or B, Medicare, they get home care nursing, they get equipment. But if they don't have that supplement, then they don't get it. And that seems to be just a whole justice effort that we need to help. And I know it's a huge question, and I don't think, Dr. Rondelli, do you have any answers for that question?
No. I wish.
It's an endless conversation, but it doesn't mean that we shouldn't think about it and just be there in spirit at the moment. Sometimes it's just that moment, and that's all we get, and that's an important time. Thank you.
Good evening. It's great to have you all here, and I look forward to the dialogue after this discussion. When Albert asked me to do this, I said, well, what is it? He said, well, it's a discussion. I said, about what? He said, well, there's a lot about ethics. I said, I don't know anything about ethics other than I'm not an ethicist. I took an ethics course, but I would never consider myself any kind of expert in ethics because you don't need to. So I came with the idea that I would just listen to Dr. Rondelli and I would take notes. So I pulled out my fountain pen and realized that I hadn't refilled it recently, so I had no ink. So I couldn't even take the notes with this presentation. So I think the idea here is that we're using this as a platform as we invite all of you to think about how this relates, to your life and to your world. Let me start out with a story. In 1969, I had just finished college, and I met up with one of my college friends who had taken a job in Panama. She was working in the Canal Zone at that time, and that was before the liberation. This was a U.S.-occupied Canal Zone, and she was working in the intensive care unit. And she had invited me to go on a world tour of South America, and I was totally up for it. So I flew in, and we spent the next nearly 3 months touring through South America that summer. We had a wonderful time, and we just explored. 2 single women in South America in that day and age was extremely unusual. And I won't even tell you about some of the battles that we had to fight off. But anyway, we somehow came back unscathed and better for the experience. We flew into JFK, and I stayed overnight that first night at her house with her parents because my mother was going to come and pick me up the next morning. But we went to Mass, and there was, as you know, all of you Catholics, in August, they're always having people visit from the charities. That's when you have the double collection sometimes 3. And so anyway, I was completely out of money because I had blown the last money on jewelry in Brazil. So I was really thinking, I'm not going to make these collections. So anyway, this woman comes, and she's coming and speaking, and she is telling us about her missions. They're in India and this, that, and the other thing. And she was so compelling. I said to Joellen, this woman is incredible, absolutely riveting in her storytelling. So I opened my purse, and I had one $20 bill left, and I gave her the whole $20 in the collection, thinking, I don't need any money anymore anyway. My mother's going to come pick me up, and I'll just get more money. So anyway, a couple years later, it was now all over the news about Mother Teresa. But I met Mother Teresa before anyone knew that was the Mother Teresa. Now, from a scientific point of view, I was a non-biased participant. She did not have the Mother Teresa hype yet, and therefore I took her at face value. This very tiny, frail woman is speaking on behalf of her other nuns in their mission. And the way she told the story with such humility. And I think that your point, Dr. Rondelli, about they pray, not because they just feel like praying all the time, but they need the strength on a daily basis to do that kind of work. That really came through in her story. So that level of humility in the face of so few resources, so many things happening in their world, she was amazing for me as a young woman and a nurse to see someone with that kind of grit. It really left an impression on me. And I think then the next person that I could add into that same category would be Florence Nightingale. Now, there was an example of someone that took a field hospital and transformed healthcare in a way that has changed it forever. One strong woman who just took on the generals and anybody else that got in her way, and she made it happen. Why? Because she saw the tremendous need. This was a woman who came from wealth, In fact, her parents often traveled in Europe, much of their time in Italy, and she was named after Florence, Italy, because they just love the country so much. She just broke loose from all of that and said that she wanted to be a nurse. She wanted to take on this calling because she had these visions and voices, and many times people would think she would be possibly diagnosable, but she took that and really mainstreamed it into something incredible. And again, enormous humility in the face of every daunting thing that she had to undertake. And now I think that Pope Francis is in that same category. What makes Pope Francis so amazing? John Paul was amazing. I can't remember most of the others, but these people stand out. Why do they stand out? Because they take on the system in a different way. Their own compelling way of changing things is so profound. John Paul did it by standing up against, the infrastructure of the Italian overseers of the Vatican. It was so entrenched. He was an outsider, and as an outsider, he could make an incredible impact. And he was able to change certain expectations and rules, and he was definitely a pope of the people. But even Francis has taken that to a whole other level. I am a Philadelphia girl, so I actually went home to Philadelphia when he was visiting, just so I could watch the incessant 24-hour-a-day newscast of Pope Francis. I didn't actually go, I didn't see him, I didn't shake his hand. But what was so amazing, because it got such intense coverage there, is that when he got out of his motorcade, he didn't talk to just the people that were there to greet him, the people that had spent $1 million just to be on the tarmac to say hello to him. I mean, they were very big givers in the Catholic community, and they deserved to be there. But he was very polite. He spoke to them, but he went up to the mother with a child in a chair. The kind of child that you were speaking about, Mary, and the love. I mean, it just was so. Just to watch it on TV, you could start crying, because again, that humility, that just ability to connect with the people. And I don't purport to know what, Francis had in his mind when he said the church is a field hospital. But if I were to have to guess, I would say that he made that statement potentially in the context of really welcoming everyone into the church and really setting a new standard of acceptance. Because the church has not always been that accepting of all types of people. Some churches vary. Some have been extremely accepting, others have been less accepting. And I think it was his call to his own people, his own ministry, that we have to be more accepting of other people. And he also wanted to invite people who have felt excluded from the church to come back and to be part of a new wave of Catholicism, a rebirth of the feelings of really what the church was founded on to begin with. So I think that, again, his humility, the humility of Mother Teresa and Florence Nightingale, we can embody that. We're not necessarily going to be going down in the history books, and our lives may not be as compelling as these figures. But in our own way, we have an opportunity every day to touch people that make such a difference that they will remember you. And they're not going to remember all your book knowledge and having the pen filled and ready to go, like all your tool set. Sometimes it'll fall into place, and other times it won't. But the fact that you are there, and I think this has already been made a point of, they're there, you're listening with compassion. You are trying to understand what that person's life is all about, and you're trying to take a very humanistic approach, thinking of all the things that you have to balance, your medical knowledge, your nursing knowledge, your nutrition knowledge, whatever your knowledge base is. But you're really not only focusing in on that. You're balancing that with the humility of your spirit that you are able to impart to others. Your spirit, which is going to make the difference. People are not going to remember necessarily everything that cured them. They're going to definitely remember how you made them feel. And the gift that you can give is the hope that they can move beyond your presence and be stronger as a result of it. Thank you.
Am I supposed to say something? Okay. First of all, I want to thank all of you because I think that you really made me even go even deeper to what my reflection had been before. And there's nothing more valuable than seeing a living testimony of faith. And I think all of you have done that for me. I want just to briefly remind, actually, that to me first, and to all of you, that Pope Francis, which we all like, for this commitment to everybody, without borders, without passports, or without legal or illegal status. The reason why he's that type of person, he explained it, is because of something that happened to him when he was 17 years old, on his way to a party as a teenager, walking in Buenos Aires. And he was walking to this party, and he saw a church, and he had the desire to visit, to get into the church. And into the church, there was a confessional with a light on. And he decided to go to confession. And he was attracted to that thing. And it was Catholic, but it was not planned. He was going to a party. And the priest there, he had the experience in that moment that his own life was a sinner. It was like he was a young man, a young kid, but he felt embraced, and he felt the mercy of God for him. And that mercy is what has motivated everything he's done from that moment on. And the picture of Caravaggio that I was showing you before is because that guy, the Caravaggio, shows, which is Matthew in the painting, is holding on the money. He's not saying, "Oh, yes, I'm ready." It is like, it's a battle. So that battle to what that identity is has to deal with what we have every day, what we are every day, what our limits, and what we are interested in, and what we are. So that identity, that mercy, that the Pope is actually the value for being able to heal other people, the healing that he's felt himself. So a couple of years ago, I had a long discussion with a few friends here in Chicago, very Catholic, but also some politically driven, and I tried to be correct. And so we were talking about the Obamacare, and so and the discussion went to, because I was passionate about it, and you see me very calm and relaxed, but I can be passionate, and I'm Italian, and I said, well, but so health to take care of a patient is not it's not an option. So it's a right for a patient to be healed, to be taken care of. The healthcare is a right that everybody has. And he told me, what are you talking about? That's not in the Constitution. That's not a right. It's because if it's a right, if it's a human right, then we should treat everybody. And I said, yes, why not? But then even education is though it should be a right. Well, I think so. So I come from a country, Italy, where everybody has free healthcare and free education. And then I went back to actually when John Paul II visited the United States in, I think it was 1996. And he had several speeches to the healthcare providers. And he was just saying, healthcare is a right. And as a human being, you need to be. So that's a big issue as a Catholic physician, healthcare providers. We live in a society here which is not really exactly that way. And that's a mandate, I think, in our small or big environment, that to defend that single human person who has the right to be taken care of. And that goes against many questions that I don't have the answer, but that's to me, I can't give up. Keep going? I said
at this point, it's good. Does the panel have any questions or comments for each other? Any thoughts that each of you might
have asked a question?
And we'll have the audience too.
Right.
But we'll as we're moving the mics around the room, do you have any comments for each other?
I think well said. Everyone
Thank you.
did a good job.
Stand, please, so we can. Thank you.
It's not on, but I'll just shout it. So my question
Well, no, come on up then, if it's, or get the other mic over there, see if that mic works.
Oh, there it is. Hello.
Okay, good.
Hi. Thank you so much, all of you, for being here and for your comments. My question as a physician in training, so it's going to be a while before I'm going to be out in the real world, as you mentioned, is I know at least with Dr. King getting to know her boys that she has a family and has to balance that with her work. And with the others, I don't know if you have families of your own or not, but advice for those of us who are thinking about starting a family of how to balance the challenges of leading a family as well as your calling as a physician.
Not me.
No.
Good luck.
Caitlin and I we'll tag team this one. Caitlin and I.
Okay.
Also, we have two little kids, hopefully asleep. 4-year-old and 1.5-year-old. Well, you cannot have your cake and eat it too. Okay, so just I think it's good to go in with a realistic expectation that if you, make certain decisions to prioritize family, it will affect your career in some way. Like for example, Caitlin and I actually, we both are technically part-time, and when you're part-time, you're not necessarily going to be on the physician leadership track, or you make it certainly is a financial thing, right? Too, right? So, but at the same time, Caitlin and I are both. So another thing is, if your partner is also the same specialty, you could share the same job, which in some ways we did a little bit of that during residency. Actually, the other thing too is healthcare now it's easier, I think, to have a family now than it was before. There's more flexibility, and but that too also depends on your specialty. Primary care is a little bit easier to do that. I don't know.
I think again, this also comes back to kind of flipping values on their head, because we're all talking about the humility and how that sort of it gives a different voice to what you're saying. So I think honestly, like having a family, having kids, maybe it's not like this in all specialties, but as a family physician, it's not only a beautiful part of my life, but I think it's one of the best things I have to give to my patients, especially so many immigrant families and people who aren't around their parents, and just having that connection of a mother speaking to another mother, or it's basic, especially in primary care. There's a lot of human interaction in addition to all the medicine that you learn, and so I think that has been an integration as well, not just like balancing the time spent in one place and the time spent in another. There is definitely an integration of those things. So that's just the one. I guess the other thing is, there's also a benefit. There's a things you have to give up, but there's also things that you're going to bring from that perspective. Is also something.
Yeah. So the positive thing that Caitlin was saying, the other thing is, like, we actually, as primary care docs, we also live in the same neighborhood where our clinic is, and that's, I think, also a powerful thing. We literally see our patients on the street and just in the neighborhood at the playground, so there's also that connection that we can make as well.
I could only say I had 5 kids in 8 years, and I work full time, and I was going to graduate school. So you have to be yourself, and if your kids can't go to a play date, you can't feel guilty about it, because that's their world right now. And also keep a part of you that you still have, like if you like to watch movies, if you like to be in a book club, still keep some of that for yourself. And the guilt thing, maybe, I don't know if it's a gender thing, because I don't think so, but you just can't feel guilty because you can't do everything. But what you can do is take care of them and love them, and try to balance your life as best you can, and because they will survive. All might have survived despite my working and all of that. So I think that's my only words of wisdom. And I've become much less anal retentive in my older age, too. So if I'm a little late for something now, which is almost always, like 5 minutes at least, but not more, then I don't sweat it. But I always wanted to be there 10 minutes early and get there. And, life happens, and it's a wonderful thing. So don't worry too much about it.
Thank you for your very rich stories, each one of you, all your experiences. My question is, how do you actually fill in the gaps? In each of your experiences, we all recognize that from what Pope Francis has given us, the inspiration, that it never quite fills the gap fully. There'll always be that gap. We never see maybe a patient fully healed. We never find out years later how they're doing. All these kinds of gaps, whether it's in the research. So how do you deal with that expectancy that the gap will be filled perhaps out of your visionary scheme or your expectation, but in God's ways? And so how do you actually accommodate that? How do you approach that? How do you deal with that?
Well, I think I don't know, there's an answer, only one answer. There's probably like a million answers to that. And everybody has experienced different. I think you realize in your life, and probably you know as well, that things don't always go the way you planned. But at the end, there's always something more than you expected. And, I never planned to be in the United States. I never planned to be in Chicago. I left at some point Italy thinking I would spend 2-3 years here. And nothing that I'm doing right now was planned. And it was not really that always that easy. But that probably applies to everything. Family is the same thing. Before the question before, I think it's only the only way for me to fill that gap is to never miss your identity. So what is important to you, and reality is where you work. So things happen, people you meet, circumstances that occur, unexpected, good or bad, problems, or even gifts. So I think I'm sure that everybody in this room has stories in his life and in her life where things happen and you are open to understand that actually something different was meant to be. So it's impossible to be in control of everything. What I try to do, and I tried to explain before, is just to look at who I am and see what happens.
Hi. Hi. I'm a pre-med student and undergrad. I'm also a person with a disability. I have cerebral palsy. And I am an employee of the Disability Resource Center on the East Campus. So my question is, in a society where people with disabilities are discouraged a lot, and for students who have disabilities who want to become physicians, do you guys have any advice for those students, whether it's physical or like learning disabilities, where they're constantly discouraged to become physicians because they're labeled as sick off the bat? Like, do you have any advice for them?
Well, in my specialty, there are quite a few physicians who have cerebral palsy, so that certainly is not a roadblock. And they did describe to me extra barriers that you are experiencing, but they're not impenetrable. So keep on going. Keep on going.
I think there's another way of looking at it too, and that is it really isn't just on you. It's really a system issue. There was a woman who came and spoke to the College of Nursing recently, and she has done research and has been speaking all over as a nurse educator to really sensitize the faculties of these schools to be more accepting of students that have disabilities. And she gave all kinds of anecdotal reports of how that change process occurs in different organizations. So maybe it's like anything else with people that feel that they're marginalized in some way. It really changes when the reference group, meaning the larger group, in this case, say the faculty of the College of Medicine, were to have this kind of development so that they would be more welcoming and more accommodating as a result. I mean, if you can hold your own intellectually and you can do the work, they are obligated to accommodate you, and in ways not just that are superficial, but are real. That they really do welcome you. So I think it's a good topic. It's maybe something that we could pursue as a healthcare system.
And I would just like to add that I would like to thank you and your organization for your witness in healthcare too, because even as someone who has had all of the privileges in the world, when I went through medical school at the University of Pennsylvania, and I'm sure it's like this at all places, there was just an overwhelming feeling that there's just such a culture, a acculturation process. So even as someone as a Catholic, it's just that it's just assumed that everyone sort of fits in a certain box. And then when we talk about, actually, we want to have more people who are minorities in medicine, or again, their patients kind of connect with physicians who are more like them in different ways. And I think, again, it's a blessing and it's a really needed thing in medicine that, sure, there will be a lot of barriers, but also seeing yourself as necessary and part of that, making us a better community in healthcare, I think it's a needed thing.
Good question.
More questions? Anybody with any answers? Any final comments from the panel?
I had a comment about your question about filling in the gaps of kind of like the unknown, or even as a physician in a place where you're not really going to fix a lot of things. You can heal people in their spirit more than you may fix their diabetes sometimes. But I think faith is really the answer for filling in those gaps. And as as Catholics, we have our particular faith, and we can your ability to have a good spiritual prayer life will help you weather those unknowns and those doubts when encountering the gaps, as it were. So, and just also like Caitlin's story about just directly ministering to that homeless lady. It's really just if you focus on the personal interactions, that can be your source of energy, of feeling as a success, more than getting somebody's sugar down or their cholesterol down or avoiding that heart attack, things like that.
Hi, my name is Beverly Chukwudozie. Thank you so much for coming out to talk to us. I wanted to ask, when you do feel stressed out or burned out in your career and what you do every day, what do you do to motivate yourself? If it's a Bible verse or something that helps you, renew and get that energy again to go back and keep doing what you do.
Good question.
when I feel like that way, I normally go home and ask myself, why am I doing this? What am I doing here? Like, what's the point? Is it worthy, right? So all these questions, I can't take this anymore. So all these things are, I think, are very human, very normal. So the answer to this question is probably, why am I doing this? What do I want to accomplish? The big picture. I think the big picture, at least in my case, is more meaningful than the small, maybe not very good-looking story of that day or that moment. And as a Catholic, I totally agree with other people that to pray and to look back at what is the meaning of what am I doing this? And it's not really a recipe that works right away. It's not a Tylenol for fever. It may take time, but there's only one track, and it's not easy because at times it lasts a long time, but it's going back to the roots, to who am I, what am I doing, that helps me.
I actually have a very tangible example because for Lent, I was going to try to sort of say a little prayer every time I knocked on the patient's door before I go in, which is quite a few times a day. And I couldn't, I'm kind of a scattered person, and so I just couldn't remember, literally, right, how many patients do I see in a day? And I just, right, that was what I was going to do. And then I had a priest just sort of suggest, I think a really great thing for you to say would be, and I have no idea, I'm probably quoting this horribly because I couldn't, he was talking really fast, but I started saying, Lord, open my lips and I will joyfully proclaim your gospel. He's like, I just love that line. I think it'll really work. And it's funny because before, where my success rate was maybe 0, now a lot of times that comes to my head, and that it just really helps me to start off the interaction on such a different note in just a very, very real way. And I think it all comes down to, why am I doing this? And what about these gaps and these things I'm not going to be able to fix? And so having something really real and something that's really in your day and something based on your Catholic tradition and your faith, apparently that was the part I was missing, I think can be really helpful.
As a Christian, all we're given is this moment. And so if you reflect, and this comes, I think, with experience and age maybe too, but at the end of the day, think about those things that you did do and that you helped. Even if it didn't turn out well and it frustrated you, or you go home and it was just a horrible day, you're only given that moment. You're not guaranteed tomorrow. So just reflect on those good things that happen, because something good happened somewhere in the day. And you can't go back and change the past, but chances are you did a great job and you touched people in a very special way, and just kind of reflect on that and just know tomorrow's a new day.
But I think for everyone, not just this question, but a lot of the themes that I think people are bringing up is you can't get isolated in what you're doing. It's so easy, because the jobs are very, very rich. They have a lot of demands in different ways, and you can spend an enormous amount of time, in getting everything accomplished. But you really do need to work on balancing it and not be isolated. Reach out to friends. Have something that you enjoy doing on your own. Something where you can sort of get away from it and not be thinking about it too much. You want to be reflective, see what you can do, better, et cetera. But you really need an outlet, a number of outlets, in order to have a balanced life. And it's hard. That is work in itself. But I've learned over many years that if you don't work at it, you can get burned out. And why wouldn't anybody? You have to feed your own spirit in different ways. Whatever works, everybody's somewhat different. But you really have to take that inventory for yourself and know that the balance is every bit as important. It's not like you're just blowing off a day or you're wasting your time or it's not as important as something else you should be doing. You have to sort of, again, it's like if you decide you're going to run a marathon, you have to decide, I'm going to do it. I'm just really going to dedicate myself to it. It's going to be a new thing, a new venture in my life, and really be sure that you've got that plugged in.
Anybody with final thoughts? Well, let's thank our panel, and thank you for your